vaccines, and if we're not sharing, there will be three major problems. One, I said it will be a catastrophic moral failure. And two, it keeps the pandemic burning. And three, very slow global economic recovery. So it's morally wrong in terms of arresting the pandemic. It wouldn't help, and it wouldn't also bring livelihoods back. Is that what we want? So it's our choice. And I hope we will choose the right things.
All right, let's bring in Dr. Emanuele Capobianco. He is the Director of Health and Care at the International Federation of Red Cross and Red Crescent Societies and joins us now from Geneva. Doctor, what's the danger here of the coronavirus vaccines not being distributed fairly, and where is the greatest need right now?
Well, during a pandemic, the nature of a pandemic is that all countries are at risk. And so in order to protect the world, we need to bring vaccines all over the world, ideally at the same time. Of course, the needs are highest at the moment in countries that are seeing right now a major diffusion of the virus. So we see that in a lot of Latin America, we see that in Africa, we see that in the Middle East, and also in part of Asia. So it's absolutely critical to ensure equitable distribution of vaccines, and we need to avoid that vaccines become a commodity that will just be provided to people in high-income countries.
So what's the solution here? I mean, how can we convince these wealthier countries to give up some of their supply when they themselves have a need? And we're seeing what's happening in the EU with supply shortages already.
Well, there are a number of solutions. One solution that has been put in place over the past few months is a multilateral institution called WHOkovacs, who has the ambition to bring 2 billion vaccines to low-income countries by the end of the year. WHOkovacs is a facility that really brings the principle of global solidarity and needs to get greater financing and accelerate the distribution of vaccines that should be starting next month. That's one thing. Second thing, many countries have ordered more vaccines or have ordered more vaccines than they actually will be needing. These countries should be ready to provide the vaccines to low-income countries. And I think the third point is we need to support science so that more vaccines are actually coming approved by the market, cheaper vaccines that can actually be mobilized in the next few months and brought to the people that need them in the low-income countries. So there are opportunities, and if there is political will, I think we will reduce the risk of inequity, reduce the risk of that catastrophic moral failure that the executive director of WHO mentioned just a few days ago.
In regards to the WHOkovacs program, I mean, how realistic is that, though? Because, again, a lot of these wealthier countries would be the ones that would be supplying the vaccine, correct?
Well, it is realistic in the sense that there are already lots of commitments for procurement of vaccines. So we know that these COVAX will be functioning and will start functioning, delivering already next month. There is more need for financing for this facility, but we also need to keep in mind this facility will, at best, cover the needs of up to 20% of the people in low-income countries. So will not be the only solution. If I'm allowed just to say one thing, we need to be very clear that the first line of defense will remain in many countries, including in rich countries, the individual behavior. We need to continually stress the point that is really through use of masks and avoiding crowded places, washing hands, that people will be saving their own lives and saving the people of others. Vaccines will help, but vaccines will not be the only solution. And so we need to really keep the focus on our individual behavior as our best tool to avoid spreading the infection and getting infected by the virus.
Mm-hmm. It's my understanding that many of these vaccines, for example, the Johnson & Johnson vaccine, were tested in African countries, but now those countries don't have access to them. I mean, how is that fair?
Well, a lot of these vaccines have been tested in a number of places, and the idea is that they would be brought back to those places. The question is how fast. and the fear at the moment that we at the Red Crescent also feel is that the pace is going to be extremely slow. Hence, it's a massive political effort, but it's also a major effort from the manufacturer to increase production and bring those vaccines in as fast as we can. Some of the predictions say that some countries will see vaccines arriving only in 2023, 2024. This is immoral, this is unethical, and should not be happening. It's up to the politicians to make that not happen. It's up to the manufacturer to help as much as possible production and increase. That is up to governments in different countries to really make an ask and make sure that this principle of solidarity is implemented. It's a tough call, but the future citizens of the world will look back at this moment. It will remain a pivotal moment in the history of humanity. We can either succeed or fail. Science is winning. Solidarity, until now, unfortunately, has been failing.
All right, we'll leave it there. Dr. Emanuele Capobianco, thank you.